You all made it. So this one's over.
So if it's going to go bad, it's going to go bad right away.
Oh, yeah.
Okay. As soon as you hit.
Yeah.
That's what's going bad. It's good to know. No, but he's a pilot. I like to learn about things I don't know about.
Yeah, and actually, like,
Just so you know.
this isn't bad. If you hit like a thunderstorm right first and stuff, that's actually really good.
Scary.
Yeah.
Why is that? Just because of the wind?
Yeah. Because it changes. So you can, like, if you're landing, it was landing to a headwind. And so you can land a windy day with like a 20, 30 knot headwind. Well, when microburst comes, the wind switches and it goes from a 30 knot headwind to 30 knot tailwind. Well, that's all the lift on your airplane. So,
What do you do?
Pray.
well, yeah, you max power and come out. You know, so I remember Delta down in Dallas 20 years ago. They hit a microburst and that's what it was. They didn't adjust power, just came in and just power right into the ground.
Let's call, oh, I have to wait for Linda.
Yeah, wait for the. You don't have rules. And so, no, county council, you have a code of civility, which I was honored to author. You do have a brief list of procedural rules that nod towards Robert's Rules of Orders, but essentially you don't have rules. So you have to look to the charter to be guided by what you can and can't do. The charter is entirely silent on this particular issue. So if you have a quorum and a majority of that quorum decides to proceed in a fashion it chooses, that's what you do. Okay. And that is my opinion based on my experience sitting exactly where you sit.
I should have at least a copy.
You should have, but I have the chair. I see. I took the chair.
And all the colorful shirts.
I took the chair. Tara. Peg, I
Guys,
believe.
I'm just waiting for Linda. She stepped out.
Bob, maybe.
Okay.
And John. Yeah, just about everybody. Could be
Most of them are on the telephone, just so you guys know.
Let's call the Human Services Committee meeting to order. Any courtesy of the floor? Nope. Sue, can I introduce you, and you can introduce the rest of the speakers?
Yes, ma'am. Thanks for trucking out, everybody, and being on the phone for those of you who aren't here.
Can you all hear her?
Everybody can hear me? Louder, even. I should pull a Liz and talk a little closer. Is that better? Okay. I just wanted to reintroduce Laurie Greco, our administrator for the Area Agency on Aging. We talked last week, the budget meeting for Human Services. The snow has melted my brain cells or something. Mr. Warner asked if we were going to be in the green, and we are not quite there, but I am thrilled to report that we went from being a very bad red, which it turns out from the state, we've pretty much been a very bad red for 5 years or so. We've been on the state's radar, apparently, even unbeknownst to us before now. And when Laurie took over and the state came back out to take a look at us, so by December of last year, we were a very low red. When the state came back after Laurie took over as acting administrator, we scored a 73, which was a low yellow. So it was that red, yellow, green. After 6 months of an unbelievable amount of hard work, they came back, and I will tell you that the score of 86 is green, and we scored an 84.5.
Oh, that's just wrong.
It is just wrong. And honestly, I will tell you, I told Laurie afterwards, I knew it was a punch to her gut as it was to mine, more to hers, because I know how badly she wanted that. I am fairly confident that the state did that on purpose, not to penalize us, but if we had been green, they would not have been back for another year. And being still yellow, they will come back in 6 months. And what I wanted to tell you, and Laurie will give you all the specific details and talk more about aging, but what I'm so impressed with is it turns out that Northampton County made the most significant amount of progress cleaning this stuff up in the shortest amount of time in the entire state of Pennsylvania.
Wow.
And they were exceptionally complimentary of Laurie and her team, and she has a phenomenal team altogether. Her PS folks who do this work are tremendous. And so they will be back in 6 months, and we will be here to report again. And I already told Laurie I have no doubt that not only will they be green, but that in a very short amount of time, Northampton County will be an example for a lot of the state. So I just wanted to say that publicly before she had the chance to talk. So with that, here's Laurie. Thank you.
Hi. Thank you, Sue. Okay, as Sue reported, we were 84.5, which was a high yellow, and we're very proud of that accomplishment. We did really want the green, but
Can you guys hear her?
we're working on it.
Okay.
Is that better?
That's
Sorry.
much better, because they're,
In the monitoring, I'll give a little more specifics, that all the areas of concern from the previous monitoring had been addressed. The current issues are things that we're just going to continue to work on. I did get the report from the state today, so I'm looking through that, and we're seeing what changes we need to make moving forward. I reported last time I was here speaking to you that we had been working to make changes with how our intakes were processed, and that's been successful. We're going to continue to try to improve that process. Getting our on-call after-hours staff active in the computer system to prevent any delays or miscommunications along the way, so they put their work right in the computer immediately. We have a shared spreadsheet that all the protective services staff have that allows us to better track the work and who has what. I did use that a lot when I was preparing for the monitoring, and it was very helpful. So that's been a great tool. Our IT helped us set that up. We have hired a 4th investigator. She is expected to start November 26th, and she's already a trained protective services worker, so she'll be able to hit the ground running. We won't have to train her. We are working to hire a protective services supervisor, so I wouldn't have to do that directly anymore. It's currently our guardianship care manager. She's working out of class and assisting me in the supervisory capacity, and that's working out very well. She's also assisting in investigating cases so we make sure we stay within compliance. To give an example of the volume of cases, in October we took 94 reports of need.
Say that again, 94?
94. Yeah, some of them were under 60s that we refer to Liberty Healthcare. They investigate the under 60s. Some of them are no needs, but they do still require processing and tracking and some follow-up documentation. So that's where we're at with our protective services unit right now. We also have an assessment unit, and they do assessments to determine if people are nursing facility clinically eligible. That determines what program that would best suit them in the community. They continue to meet their deadline for completing it's called an LCD, is the assessment they do. They're averaging 99% compliance. They're using the LCD until a new tool begins. It's called a FED, Functional Eligibility Determination. That was expected to begin in July, but now it's been put off until next April. So when the state gives us that tool to use, we'll be using that one. So we're working with that to meet those needs. It is a bit of a strain because the FED tool is expected to take about half the time that the LCD takes to complete. So they're keeping up with the volume. They're really doing an exceptional job of meeting that. The assessment supervisor actually is working out of class currently as a deputy administrator for me as well. So we have a really solid team around us, and we're wearing a lot of hats. And they're all doing a great job. She'll be eligible for that position at the end of December per civil service, so we're hopeful that full-time transition occurs. We have our options unit that gets people set up with services in the community. They also are doing the emergency fuel assistance program that started in November. As far as the LCDs, last year in October, our assessment unit did 150 LCDs, just to give you an idea of the volume of work that we're putting out. So our options unit, since November 1st with the emergency fuel assistance program opening, we've only processed 7 so far, but the referrals have been coming in, and they're treating them as a priority. People need heat, especially this weather that we're having now. We do have a wait list currently, which is a funding issue. We're still trying to get that worked out, especially with the LCD and the Fed and the change with the reimbursement rates.
Is that a wait list for all services or just this?
For the in-home services. We're still providing home-delivered meals to people.
Thank you.
There's roughly 100 individuals on the wait list right now, but we are serving 572.
Wow.
For our senior centers, the director and her staff have been training in the health and wellness programs. The state issues health and wellness goals that they need to meet every year, and they're working diligently to meet those goals. Their plan for 17-18 was approved, and the response was very complimentary, especially regarding our outreach to low-income, medically underserved, and the Spanish community. Our director and the Forks Center manager recently attended the Pennsylvania Association of Senior Centers Conference. They were speaking in regards to a video titled Junk Mail that was recorded at our Forks Center about one of the participants. She talked about how sometimes seniors are forgotten. So that was quite an impressive accomplishment for one of our center directors. We recently got a contract with the Easton Area Community Center that's opened as another congregate meal site to allow us to provide meals to more individuals in the community. And the Senior Farmers Market program that we do every year, that ended September 1st. And we're given 10,000 vouchers by the state. We distributed 8,000. And Kim, our senior center director, she's already planning for next year of how we can exceed that and get to the 10,000. She's already booking with some of the local farmers markets for next year, so we can market it more and people will know that it's there. We have a caregiver support program. We hired a new care manager. She's fully trained and doing that job, as well as assisting our options unit with the emergency fuel assistance program. That helps to, like I said, ensure that those are treated right away. Historically, that's been an underspent program of ours, so we're looking for ways to incorporate more of our people, especially the ones on the wait list, to get them set up with that program, to start getting them some services. We have an ombudsman program. We have one staff ombudsman and numerous volunteers in the community. And we're working on internal tracking to ensure compliance moving forward with that program with their state monitoring requirements. And finally, we have our PRIZE program, and that deals with Medicare and Medicare open enrollment. So our PRIZE staff and our volunteers have been very busy with that. And that's it.
My gosh. So total staff that you have in your department?
I'm sorry?
Total staff that you have working for you?
We have 20 in the office, and then we have 11 senior centers that are staffed.
Anybody have questions? Mr. Dietz.
Yeah, just
Who's
I think
that?
That's wrong.
Oh, that's
Oh, hi, Ron.
All right.
Hi. You're all hi.
I just wanted to congratulate you again on the work you've done to turn it around. And then with that, I mean, what do you think was the main cause of the poor performance there? I mean, funding, leadership, staffing, or
I can't really.
Probably answer that.
okay.
Yeah.
Laurie's being gracious.
You could see that.
She's good like that. Ultimately, it's a leadership issue, and it's not for lack of effort. Previous leader attempted to do everything for everybody, but as a result, some of these more administrative things didn't get done. Now, never was there a time that any of our seniors or elderly folks were at risk. These were documentation issues, but they were significant. And so Laurie's been able to really focus on her duties and get that resolved. I know you weren't going to say that. So.
Yeah, no, and I appreciate it. I think it's great, and also I guess that we set up a formula so that anytime down the road, if you're ever not in the position, or that we continue and keep it going that way. Of course, we want you to stay there, but I mean, so. There you go.
I think that was a show of support.
Yeah.
Yes, thank you.
Yeah. So thank you.
Can I ask anybody on the phones, do you have any questions for Lori? Was that a no? There was a little garbled there. All right, anybody else?
Let her go home.
Let her go home? Okay.
Thank you. Thanks.
I just want to, again, commend you for what you've done. The reason we wanted you to come back is because your department started in such a tough space, and for you to have turned it around this way, I think it's unfair that they gave you the 84.5. You're all green in my book, dear.
Thank you very much. I appreciate that.
Okay, thank you. Okay, report on Gracedale. Sorry.
No.
I didn't see you.
I jumped turns. I forgot. Sorry, Jen, I forgot. I will sit down. But I wanted to say before Laurie heads out, if she's heading out, that the one thing I forgot to mention is all of that work was done before the fourth PS worker was hired and before the supervisor was hired. So, I mean, obviously I can't say enough good things about this group, but the greater things that will be done with the addition of those two folks is, the sky's the limit. So.
Let me double back, and just because I was sidetracked by this phone thing, is there anything like if I gave you a wish list or a needs list that, because you've done a phenomenal amount of work, is there anything that you still need or are lacking to be able to do your job well?
I think the biggest obstacle we face is the staffing, and the biggest obstacle to our staffing is the civil service.
Yeah, which nobody can fix. Look, we are making tremendous headways, and Northampton County is still, I have learned, significantly further ahead of the curve in Neogov and civil service than almost every other county. But we're getting there. By the new year, we should have some final key folks on board, with hopefully only one or two openings left in aging. So we're making progress.
Can you explain so what the issue is with the civil service in that position, and like how that complicates?
Some of it is a matter of timing, in terms of the same stuff you've always heard of how long it takes to get things approved. Our out-of-class deputy administrator we originally submitted her application to civil service for approval, and they approved it, and we even sent an email clarifying the approval. The fabulous Georgine did that. And then 2 days later, we got an email saying she wasn't qualified. And there was it was a 2-month glitch of an issue, which in 2 weeks will be no more. But that was, and I pled our case, but they didn't care. So those are the typical kind of issues.
Anybody else?
Okay, I will let.
Ron, do you have your phone on mute?
What?
You have your phone on mute,
No, I have it on. Why?
because we can hear everything in the background.
I'm sorry, Jim. Sounds like he's at Burke.
I take it they had the other meeting at 4.
I can't hear you, Ron. If you're ordering Burger King, put it on mute. Hi, Jen.
Good evening.
Where should we start?
Well, I'm going to start with giving you
Oh,
some
this
of-
is a whole new, oh, you guys are missing it. It's a whole new thing. It's not a dashboard. Woohoo. Go ahead.
It's a compilation. So I'm going to run down some of the Gracedale highlights with you first. So I know I sent the pictures out for the Halloween dinner that we did have, and it was a huge success. The residents absolutely adored it. They had some great food, and the decorations were just lovely. Everybody did a great job. Therapy, activities, the volunteer and dining services all did a fabulous job. The residents are still talking about it. We had great success with the trick-or-treat. So we had over 125 children come through our gardens where we had 14 stations set up, and the residents were able to give out candy. And then we had residents throughout the gardens just watching the kids go by. So that was a pleasure. We did have a parade, a mini parade. We had 6 residents that did attend to go over and get their pictures taken. So in total, there were about 44 residents that did dress up and have their picture taken. Only 6 wanted to parade through the arcade. Hiring, we continue to hire. We have 12 LPNs starting in this next class, so that's going to be a very welcome sight. Continue with the CNAs. RNs, we have 2 starting, and that continues to be worked on. One of the hardest areas we are hit with is dietary. So I'm going to try to work with some sections in the county to see if there's anybody who needs jobs, and we can get them in through the dietary department. We do the town halls. I put them to every other month, so the employees are welcome to come down, vent, get some information. We talk about everything and anything that they need to talk about. That's been a success. On shift. On shift is our scheduling system that we have. We decided to make a purchase to an engagement system that complements that, and what they are able to do, the employees, is to contact us and tell us how everything is going during their work. They don't have enough supplies. If they're having a bad night or a good night, they can let us know in real time. But what it also does is allows us to reward people for doing those above and beyond things. So it's a point system, so we can start maybe rewarding them with a dress down day or something that makes a little difference. For any day that they want, they can dress down. So it's the little things that we can do for them. We continue to work on our computer system. We've had it for 4 years, and it's like we just got it out of the box. So we're working closely with IT to make this happen. It's a frustration at Gracedale to have this computer system that everybody has worked hard on, and every time we do an update on it, it wipes out some other stuff. So Melissa Schaefer is spearheading that, and she's doing a fabulous job. Quality measures, which is what the Department of Health looks for when they come into Gracedale. We continue to work on that diligently, monitoring them. We use one of our systems as Abacus, which we get to interview families, residents, staff, see where our weaknesses are, and it allows us to really, in real time, attack those areas. Wounds continue to decline. As of this month, October, we had 31. So we've gone from about 100 down to 31. Candy treatment team and the nurses are doing a great job. They hit little hiccups, but every time they're improving it and really getting the job done. We're training LPNs to look at them, look at a wound, decide whether it really is a pressure sore or is it from a wetness. So we're dividing that so that they can really understand what those areas are. We do work closely with Wound Solutions, who comes in on Tuesdays and Thursdays, and we'll go around to the floors and look at wounds so that they can also address what needs to be done with those wounds. So I think all of that and therapy, working with them on sitting positions and doing all those little extra things for the residents to make them comfortable, is where you see it coming down. Falls we are working on. We are meeting as a team to develop a management tool that we can branch out to the units and get a real good grasp on our falls and what the root causes are.
Can I interrupt you there?
Absolutely.
'Cause, like in regular hospital, falls are one of those things you get an automatic ding for. So is it the same in your system with the state?
It depends on what happened. So if they have to be reported, but if it's a fall with major injury, that's when you're looking at the Department of Health. And we notify them, we put a plan of care and let them know everything that's going on with it.
Okay,
So
thank
we
you.
do notify. So we're doing audit tools too, because you have to look at falls as there's many different reasons why. Is it a medication they're on? Do they need to use the restroom? Are they hungry? Are they just, with dementia populations, are you looking at they're just very active? So you have to look at all of those things. Maybe they don't want to go to bed at 7 o'clock or 9 o'clock. They want to be up and moving. So we have to take all those in, dissect the resident and when it's happening, look at all of the causes, and then try to develop a program that everybody can do and handle, get a grasp on it. So emergency preparedness, which is a big thing. You're supposed to do 2 activities a year. Usually it's going to be a tabletop activity and a active activity, which you can do in joint partnership with another hospital, nursing home. We've had 2 at Gracedale that I was able to use as a real-world experience. We had a water shutoff while we replaced the steam line pipe, and then we had a diesel fuel leak that happened in the rain. So we have our after-action reports all ready for life safety when they come in. We're working closely with Mike Amelie and Parks to get a handle on life safety. Life safety looks at the building when they come in. Like DOH looks at the residents, life safety looks at the building. And they're going to be coming in too. They usually follow right behind Department of Health. So we now know that they do everything online. So we're working together with Mike Amelie and Scott Parsons and Dave Kaesler to get everything situated for them when they come in. Residents. The residents have been selling candy bars to raise money for the Friends of Gracedale. So far, it's only been maybe a little less or a little over a month. They've sold 2,000. They've done very well. They were able to purchase 33 songbooks, not for all the money, but it's going well. They're partaking in this because they want to give back to each other. And we do have an auction coming up where the residents will be given $1,000 to go purchase items that they can give as gifts. So we're looking for donations through different family members, and we have different places that are donating objects to bring in. One of the hiring that I just wanted to show you, which is really beneficial, we created this with Shauna, was a nursing career path. So it's the ability to see, if you become an aide, how far you can go and what departments you can get to work in. Gives them a little brief description. It gives them to say, you don't have to just be anything. You can move up in the place, you can move up in the county, you can become anything. So it gives them goals if they'd like. Absolutely. I can certainly make you copies. And I'll give you this one and you can have it. One of the things that we did to help with falls is that we did, Medline is a huge company that works in the medical industry. They provide us with they helped us with our wounds. So we got the wounds down through the barrier creams, all kinds of things, interventions, resizing on any of the disposable pants that they need. So they've been able to help us. So one of the things that they showed us was this medical equipment, and it retrains. It's called a Neurogym. So it actually retrains your brain how to use the muscles and work out your body. So instead of having 2 therapists, maybe one in front and one behind you, guiding you to try to learn how to walk for a stroke victim, this allows you to rebuild those muscles. One looks like a contraption, but it really is a walker that allows them to walk with the safety that if they fall down, it catches them. So you're not compensating with someone else. You're doing it in your own body. So you can take a few steps to the side and correct yourself without the fear of falling on the floor. The other one is a pulley system. You have your weights, and you're actually using yourself. You're connected to the weights, and it pulls you pull yourself up, but it eases you down. And I had a resident who tried it out, because 2 days ago is when they first came in. He came in and had to call us up and let us know that he did 3, but next time he's going to do 5.
Aw.
And that was somebody with a stroke. So it's improvements that are being made. Slowly but surely we're going in the right direction, and we're so excited for it. So I even have copies of those for you as well. And you have the Premier report in front of you. So if you have any questions. Census is doing really well. We're at 671, which is obviously above budget. That means we only have 19 beds to kind of move people around.
Do we have any questions?
This is a new report. It's differently formatted than normal, or is this the same?
That's the same one.
Same one?
Yeah.
Okay.
It's the Premier report.
Okay.
Oh, Ray couldn't be here.
Okay.
It's not that he wasn't.
Right, it wasn't that he was unable, yeah, he had a personal matter he needed to attend to. Yes. I know last night, and you discussed about the $550 for the short-term rehab. There's a reason why we had talked about making that increase. So every year we usually go up $10 for the regular rate and the private pay rate. But we had a problem on the short-term rehab several times, is that because all beds are certified Medicare and Medicaid, you cannot move a person if they truly do not want to. So there was some points where our short-term rehab was filled with long-term people because they get those extra services. You know, you have the therapy right there. Our menus are a little different because you're kind of trying to compete with the other nursing homes in the area. Same food, it's just a little different. And they're 1- and 2-bedded rooms. Most of our beds in our facility are 4-bedroom rooms. With give and take, we do have some 2- and 1-bedded rooms. So we needed to find a way that to make it maybe a little harder, and not that it would impact any Medicaid residents, but if you're a private pay, you may think a little differently that if you're going to pay $550 as a private pay rate, then $350. So we thought we would increase.
Yeah, so I'm glad you brought it up, because that actually was a concern that I had, and I was going to ask you on that is, do you think there will be any negative impact? So my fear is if someone's insurance, say, you know, the standard policy caps out at $400 a day or something like that, now we've raised it up, are we hustling someone out of there that maybe should be there for the 21 days, and we're, you know, or they're leaving there with a bill that they got to pay that if they're already, you know, in a bad financial spot, if their insurance is only covering $400 a day, now they got to come with, you know, $150 a day. They're in there for 15, 20 days. They have a couple $1,000 bill they're walking out with.
No.
It was my concern.
Yeah, and we won't have that. So our billing offices will work with the insurance companies.
Okay.
Any other questions or concerns or comments?
On page 4, just if it's in red, I don't know, what does that actually mean if it's in red under facility?
Those are areas that we are currently working on to get below the PA average and the state average.
Okay.
Yep, so
All
those
right.
we are currently tackling and working
Okay, so
on.
the red kind of identifies the
Yes.
little problem areas that you're working on. Okay.
Correct.
All right. Any yellows then? I mean, up here, is that just yellow for any reason at all, or not really?
No, I think that's just the highlight.
the
yeah.
red there. Okay. Gotcha. There's not that much red, but
No.
okay.
And we continue to wait for our survey, which could be any day.
I was just going to ask that.
So once we get that survey in and everything goes well, we're hoping to move up.
When they come, how long do they stay?
Well, under the new survey, so it's used to be that they'd come on a Monday, Tuesday, and they'd be out by Friday. It could be shorter. So usually you're looking at 3 to 4 days average, because they're doing all their pre-work, their prep work in their offices. So once they come in, one person meets with the administrator, and the rest of the teams are already on the floor.
And they
They're
always come
locked-
on a Monday?
Well, they can come anytime.
Uh-huh.
But yeah.
Lori?
Yes.
Bob.
Hi, Bob. Go ahead.
I'm sorry I'm not there with you guys, but looks like we're going to spend time in Palmer Township. I want to ask a question. The 21 or 20 days that a person has in short term, that can be appealed, correct? And most of them do get appealed, and they win.
Correct. So it depends.
So how does that?
Sorry.
Go ahead, Bob.
No, I was just curious how that affects your formula.
For the 550,
Yeah.
it won't affect it until they actually get off of the rehab stay. So if you appeal, again, mostly Medicare and insurances will grant you possibly a 2-week extension, and then from that point on.
Okay. All right. But it really doesn't have an effect. That's good.
There are a couple other county nursing homes that are doing this because they ran into the same similar problem, is because we can't push people off of a unit because it's a dual certified bed. This was their alternative. If you maybe push a little harder financially, would they be more apt to move? Again, if it's a Medicaid resident, it's not going to affect them.
Yeah, well, I mean,
Thank you.
You know, so I got the Medicaid. My concern was maybe they're still private pay, but still not well off,
Right.
and we're crunching them in any way. That would
No,
be my concern.
it would just be when they hit that point of long term, a decision has to be made.
Sure. No,
And a lot of times when they've been on the short-term rehab, if there's an equal like bed, that goes to them.
Any other questions from anybody on the phone? John?
No, that's it.
Tara?
I'm good.
Okay. Ron?
Let her go home.
Thank you.
We're all camping out here, Ron. We're having a pizza party later. I guess.
Hot.
Yes, that's on the record. Thank you, Ron. He said we're all high.
Thank you.
I wonder if they put that chart over at the college, the chart at the college.
Is it my turn?
It's your turn, because I have to let you go home.
Listen, I think we're all in a better position here, going home when there's a few less cars on the road.
Yep.
Just a couple follow-up things about Gracedale. I was going to mention, Jen did at the end, about the window we are in for our survey. I don't remember if Ray mentioned it last time, but we did complete a mock survey, and which is, it is what it says it is, and it comes up with a list of areas where we might have deficiencies and things we need to take a closer look at. So plans have, corrective plans have already been put in place for those items, so that when the state comes, Department of Health, when they find these same issues, which, when you have folks flagging for falls and wounds and psychotropic meds, all the, kind of the big problematic areas, one of the things that's important to them is that we've already recognized where we have room for improvement and have developed a plan to do so. So that went well, and they did just in the last week or two finish all of the corrective plans. So that was good.
Had they done the mock tests before, or is that new?
Yes.
Yeah. Oh.
I would have hoped they did.
Yeah.
Any hospital, residential, nursing home like setting, generally speaking, would do some sort of mock survey before the actual survey, whether it's yearly or some or every few years. Our DON, Dawn, is actively working with HR to update position control, which is the list of all of the open positions at Gracedale. That's, 700 plus positions. It is a monumental task, which Dawn said today she is confident they will complete by the end of the year, which will it will, one, save the county money, but two, it will also help us when we know we need a certain position that maybe is, it will just help us better identify if we need specifically folks on first shift, second shift, third shift, and where exactly those folks are. We have a good idea of that just by looking and seeing and knowing, but this will certainly enhance that process as well. So that's a big task, but she's able to take that challenge on. And the 12 LPNs that Jen mentioned that we hired and are going to be starting are all for second shift, correct?
I think
All but one. So we've talked about our focus on that shift. That's a big number, and I know they're really excited about that. So, any final questions about Gracedale before I move on?
Did anything come of the recruitment or the tuition strategy that you started at the beginning of the year? Do you have anything to close the year with on that?
Can I? Next month we don't meet.
No. You could table it till next year.
That would be great, because the answer is yes, we made progress. We were not able to include as many people as we would have liked because of the attendance policy, being that you have to have good attendance at work as a criteria, and we are very hopeful that now that we have brought the tuition assistance program back, that will be an incentive for folks to think more carefully before calling off excessively. And it's not, you can't ever be out, it's the excessive absenteeism. So yes, but I will get that. We do have some folks. I just don't have the numbers off the top of my head. Okay. I'm going to start. I have just a couple of updates in a few different areas. Children and youth. I told you last month that Pat Himmelwright, our assistant administrator, was retiring, and I am very happy to let everybody know that Julie Bader was promoted to that position. She is currently a program director in our CPS division, I believe, but she wears about 4 different hats. So we're really excited for that, and now we will, of course, have to fill her position, and so it goes as the cycle continues in children and youth. But I'm excited because it hopefully, we've had a lot of the same people at the top and admin in COIF for a long time, and it's a great team. But some of the shifting will allow some of the other folks who've been there a while as well the opportunity to develop professionally and move up. So I'm looking forward to that as well. And the only other thing for CYF, we are working on implementing a new program for drug-impacted expectant moms. So modeling, in fact, Maura McGuire, our managing attorney, is the one who learned of this program earlier this year, and Berks County, I believe, is the one who is, that's where she learned about it, but they have a program where they are working with moms who are drug addicted prior to giving birth. And our family group decision-making unit, the goal will be for them to work with the expectant mom and mom's family, friends, support system to create a plan for the baby when the baby is born so that children and youth doesn't have to get involved in the first place in anything more than a prevention supportive role. So really trying to avoid placement.
Does that include methadone as well?
In terms of as a treatment? Yes. I believe so, yes.
That methadone, that drug impacted, but methadone maintenance mothers would be included in the programming.
Well, potentially. The goal is for hospitals. We will partner with hospitals because unlike a typical child line referral where there's abuse, neglect, they have to call us. There's no baby born yet, and so the hospitals can't call us until the baby's born. So it's going to be a partnership effort. So for moms who are on a maintenance program and are stable, there might not be a need for us to even be involved in this kind of program. But if the hospital felt like this mom was not stable enough, then yes, that could be something that we would absolutely get involved with. So we're working out all those details, but that could be, especially with the placement numbers just continue to increase, and in large part at the moment due to the addiction issues. So this could be better for families, better for babies. So we're really excited about it. Questions about that? Health choices. I am pleased to tell you that a position, or the administrator position, has been offered to someone. I am hopeful that by tomorrow morning I will have a very positive answer. Unfortunately, it's not tonight for me to share with you. But we're excited to move forward with those folks. And sort of just as a shout out, first of all, they've done, the 3 staff who are there, Rich Lieberman, Susie Temple, and Tisbeen Musa, have just been tremendous in terms of, they've always worked well together, but working well together in Deb's absence to keep the ball rolling, have our consumers' needs met. They've done really well. So I'm very happy to be able to report that. I also learned at Magellan in the last couple weeks that Northampton County, Magellan is the MCO for about 6 counties in PA, and out of all those counties, Northampton County has the fewest denied claims for our folks, which is really thanks to Rich Lieberman and a system that he developed a year or 2 back with this problem list of events that he worked with Magellan on every week, and I think he told me he got that list from the 20s or the 30s down to about 4 or 5 things, and the number was much lower for denied claims, which again is good for our consumers. So I wanted to let you guys know that. Questions about that?
Full name of an MCO, medical chairman. Officer.
Managed care organization.
Thank you.
That was a good test. I had to think there for a second. Sorry. I think I mentioned before, we partnered with DCED for rapid rehousing funds, and I believe we've contracted with Conference of Churches to really essentially be a fiscal partner. They're going to be our check cutters. It was $100,000 that we will get to use in all of Human Services for rapid rehousing funds, whether it's somebody is being evicted and they need, last month's rent paid, or somebody who's homeless and has a job, so they're in a shelter perhaps, but they haven't saved up enough money for a first month's rent, security deposit. These kind of funds would help these folks. Just like Laurie mentioned with the seniors and the utility bills, the same kind of situation. If folks have outstanding utility bills, these are things that this money can assist them with. So all of our Human Services divisions will be able to utilize that pot of money, and as soon as we get that signed contract back from Conference of Churches, we will be good to go. So that's the timing. Obviously, as we have a winter snowstorm, is good for that. Just two other topics. Drug and alcohol. I just wanted to let you guys know they are applying for more opiate grant money. This is going to be for case management services and CRS, which is certified recovery specialists. So it's a CRS is sort of a combination of an AA sponsor and a case manager. It's somebody who provides additional support above and beyond a mentor, has less paperwork requirements than a case manager, but it's truly meant to be a side-by-side partner and support person for anyone in recovery. And we have 2 agencies in Northampton County who ultimately are participating in that grant with us. So whatever funds we receive, those 2 agencies will split in some capacity. I'm not sure how we have that worked out budget-wise. So that I think that Beth Miller sent that out today via email. I think it was due tomorrow, so hopefully we'll hear about that soon. And I think you all know about the Recovery Center change on Main in Northampton. Tiffany Rossinice likes to talk about how there was no, air quotes for those not here, there was no drug problem in Northampton. But, of course, there's a drug problem a lot of places. So their local folks, township, borough council, there was some concerns developing. They thought we had cots set up with folks, homeless addicts, sleeping in the recovery center on Main Street. So the manager of that recovery center went and did a presentation, and all 12 members were thrilled, could not have been more supportive by the time that conversation was over, offered additional assistance. They're going to be doing some programming for the folks there. So that is going really well, and we're really excited about that. And the last thing I wanted to mention was an update on 2 laws, one of which passed this year and one which did not, but will be continued till hopefully will kind of recirculate next year. So when Children and Youth does investigations of abuse or neglect, if something is unfounded, which doesn't mean it didn't happen, it could mean there's not enough evidence to support it. It could mean it didn't happen. It could mean that we know full well that there was abuse or neglect, but the child is not a good witness, and so it is not going to get far enough in the process, and so it ends up having to be unfounded, uncooperative. We've had situations where we are confident that there was some abuse happened and the family becomes uncooperative. So those records, unfounded records, we have only ever been able to keep for a year. The reason this is problematic is because if you have the Smith family, they have something unfounded in 2018, and in 2019 or early 2020, we get another referral in the Smith family. Technically, we can't go back and figure out that we've investigated this family before, and that's a big determinant in whether or not kids ultimately end up being placed is the number of referrals that we get on families. So this new law allows us to retain unfounded records for anywhere from 5 to 10 years, which was a huge win, and will ultimately help us better investigate families where we have multiple referrals over the span of years. Because there's families that we've had referrals dating back, a decade or more. So we do have those families, and this will be very helpful. So I just wanted to throw that out there. There's a bunch that didn't pass, but I just thought one that was interesting and wanted to share, if I can get back to it. They were trying to pass a bill fostering independence through Education Act, which would have waived tuition for youth coming out of the child welfare system at state colleges in Pennsylvania. So it is thought that will be taken back up in the next session, but I'm really hopeful for that, because that's in terms of kids who age out of foster care, the statistics about homelessness and difficulties getting employment are tremendous. So this could be a big win. So I think that's all I have for the evening. Any questions?
Sounds good. Anyone on the phone have questions? Ron? John?
No, you covered it all.
Okay.
I'm at 25th Street.
Thank you for that update, Mr. Heckman. I just have one thing for you, Susan. I think we all agreed that we're not going to have a meeting in December. Can I say that publicly? So we'll see you next year. Thank you. Yes?
Please say it publicly.
Everybody's tired of hearing me.
No, you've done a phenomenal job jumping in here this year, and we appreciate everything you and your team have done.
Thank you. It's my pleasure.
And the only other thing I would say is keep your eye out for psychostimulant grants. Okay. Because I went to a workshop recently, and the leader of it was someone who's been cutting edge in the field forever, since Woodstock. Okay. And he said an opiate crisis, no, literally, yes. He was the doctor at Woodstock helping people. And he's been the author of every major study in the addiction field. And he said every time there's an opiate crisis, it's always followed by a psychostimulant crisis. So
somewhere I just was,
keep your eyes open.
They said the opiate use is already on the way down.
Yep.
Not a ton, but a little bit. And meth and something else were already on the rise. And that's correct. If you look at the last 50, 60 years, there's a pattern, and it repeats itself.
We could get ahead of the curve if we find some grant funding for that.
That sounds great.
All right. Thank you so much, everybody. And I will adjourn the meeting.
Hey, Lori.
Yeah.
What kind of grant?
Psychostimulant grants. Treatment of psychostimulant abuse. All right, bye. See you next year.
Thank you.